AB 1722.
Thank you, Mr. Chair and members. First, I'd like to start by accepting the committee's amendments. And I'd also like to thank you, Mr. Chair, and the committee staff for all of your thoughtful consideration and working with my staff and stakeholders to bring this bill forward. AB 1722 would provide the option for local educational agencies, LEAs, to hire licensed vocational nurses under the required supervision of a school nurse. There's a shortage of school nurses in California, as we all know. The recent pandemic has only highlighted this crisis, bringing the problem to the forefront of my conversations nearly daily. A school nurse in California is required to be an RN and earn a credential in addition to their nursing degree. The credentialing process, which is similar to what teachers go through, can take up to 2 years, and there are only a few schools available, and it will cost more than $10,000. These factors, along with others, contribute to the existing and continued shortage of RNs and school nurses throughout California. And while most school districts throughout California are experiencing school nurse shortages, rural schools are more likely to lack nursing support than those located in more urban areas. Just one example, a school district I represent has gone without a school nurse for 4 years. Schools are forced to hire a 2-hour health clerk in place of a more qualified healthcare professional. As a result, the reality for so many of our students means going without a school nurse. This leaves school staff without medical training as the ones applying Band-Aids, dispensing medications, managing allergies, asthma, monitoring blood glucose levels, and handling medical emergency. With our students facing unprecedented increases in mental health issues and the rise in type 1 diabetes, we need more healthcare professionals on our campuses for our children, and this bill helps us get there. With me today to offer supporting testimony is Scott Lay, Superintendent for Nevada County.
Thank you, Chair and members. As Assemblywoman Dolly just said, my name is Scott Lay. I'm the Nevada County Superintendent of Schools. I have been in Nevada County education for 31 years, 22 years as a superintendent. I oversee 10,500 students in 9 districts and 6 independent charter schools. Over the past 5 years, I've seen an alarming decline in the number of RNs available for schools. And with COVID, this greatly accelerated that process. Most of our nurses were burnt out, overworked, and underappreciated during COVID, sadly. And with us, after the 21-22 school year, 50% of them retired, resigned, or just changed careers altogether. Currently, we have 7 RNs for our county that serves 7 districts and 5 charters. That means 2 districts and 1 charter school still do not have a registered nurse. They're doing something like a health clerk, a principal serving as the health aide, the nurse, secretary, teacher, custodian, whoever. It's all hands on deck. One district just found their nurse yesterday, and they'd been searching since May of last year. With that, as you heard, my colleague in Sierra County, which neighbored us, is in year 4 without a nurse. He's found many LVNs, he's found nurses from Nevada, but none of those pass the criteria required in California to allow him to pay for a nurse. Simply put, we can't find enough RNs to serve our students, and that becomes a safety issue for our kids. I believe AB 1722 goes a long way to help us solve this issue. By putting LVNs in, our districts can hire these people. We do have a lot of LVNs in our county, and my colleagues in neighboring counties do as well. Our county offices could then hire the RNs to oversee them, and I think that would work out very nicely. I believe it's critical that this passes, that we can do this, simply put, to take care of our kids. Thank you.